Hello, I'm Aimee Allbritton. I'm one of the Senior Vice Presidents for Memorial Health System. And during this COVID-19 pandemic, I'm serving as our organization's Public Information Officer within our Incident Command structure. I'm here today to share information with all of you, the communities that we serve. In most disasters, healthcare workers and first responders are often referred to as the front line of defense. But in this pandemic with COVID-19, it's different. We're in the back. We're getting prepared. We're caring for the patients who are here now. The real front line, it's you. It's our community. You are fighting this COVID-19 pandemic in front of us. And we hope that that fight never makes its way to us. You, our community members, are the true front line. You play a critical role in reducing the number of people who come ill and the number of people that we need to care for. You, each and every one of you, are required to keep us safe. We need you to stand and fight. How do you do that? It's your actions. It's the things you do and the things you don't do that are going to help flatten the curve. So the first thing you need to do, stay at home. If you don't need to go out for essential activities like going to the grocery store to get essentials or going to the pharmacy, then you need to stay home. This isn't the time to have friends over. If you don't live with them, you shouldn't be spending time with them right now. We also need you to practice good hand hygiene, and this means in your own homes, always washing your hands 20 seconds with soap and warm water, and doing that anytime that you pick up something or touch your face if you're outside of that area. We also need to make sure that we're all following social distancing guidelines when you are out and around others. What is social distancing? That's a new term for all of us. It essentially means staying 6 feet away from other individuals so that it protects you from anything that they may be shedding if they have the COVID-19 virus and are unaware. Why do these things matter? Why do we need to stay at home? Why do we need to social distance? And why do we need good hand hygiene? The goal is to slow down the spread of this disease in our communities, in our homes, and in our healthcare organizations. Slowing the disease spread is going to allow our hospitals and hospitals all around the country to keep from being overwhelmed by a surge of patients. We're all talking about preparing for the surge. That's what's happening back here as the last line of defense. But we need you at home being that frontline defense. As we look at how we can make sure that you have access to accurate and timely information, we've decided to start a new series here at Memorial called Kovat Conversations. We're going to be launching our first Kovat Conversations later today. And in those Kovat Conversations, we are going to talk with the experts here at Memorial Health System who are preparing for the surge and who are providing the care that is going on now. They're representing areas like infection prevention, our medical staff, our testing coordinator, all of our ambulatory work, the leaders in this organization and the colleagues that they're representing who are preparing to be that last line of defense. So what do we want you to do when you see these COVID-19 conversations come out? First, we want you to watch them. Second, we want you to share them with your family and with your friends. You can do that through social media or through access to our website. And why do we want you to do that? Because we want accurate information out there. Right now, it's understandable. People are scared, they're worried, there's a lot of anxiety, and there's a lot of misinformation going around. And our goal is to make sure that you know the truth, that you have accurate information about COVID-19, how you can help by fighting the fight. So thank you for being the front line for us. Thank you for doing everything you can. Every day as we come into our organizations, We see as we go down the streets the Heart for Healthcare signs around the community. We see them on cars, we see them on doors, we see all of the support that is being shared on social media, the donations that are coming into our organization of food and drinks to support these people are so appreciated. And what we're asking you now is, if you want to show that support in the strongest way possible, we need you to be that front line. We need you to do everything that you can. For hundreds of years, our organizations have been here to be there for you and your families, to care for you when you need it most. You've counted on us, and now we're counting on you. We're asking all of you to be that last line of defense, and we're here for you. Our mission is to improve the health of the people and communities we serve. While we never thought we would see a pandemic like this in our lifetime, it's here. We're getting prepared, and we will be here to care for you and your family. We need you to do the same thing, because the longer this goes on, the longer that your grandpa can't have visitors in the nursing home. The longer that your favorite hairdresser or small business owner is out of work. The longer our healthcare workers are isolated from their families as they spend more and more time in the organization. And the longer families have to delay important celebrations like birthdays or ceremonies like funerals. So we need you to stand up for the community and fight and be a part of the front line. Thank you.